Hello, I'm Billy Gross, a senior planner with the City of South San Francisco. Since 2019, the city has been working on Shape SSF, an update to our general plan. The general plan is the city's blueprint to guide policy and development over the next 20 years. It has an impact on every aspect of our community, including safety, parks, transportation, and housing. The general plan team has gathered community feedback at each step of the planning process. We're at that point again as we transition into the policies phase. To begin the next round of community conversations, we have developed policy frameworks which highlight key potential outcomes, performance metrics, and guiding policies on topics such as sustainability, health and environmental justice, mobility, and safety. Now, we want to hear your feedback to these frameworks. In order to provide context and to explain why these topics matter for South San Francisco, our team of expert consultants have created primer videos alongside some of the frameworks. We hope you find these videos helpful, and we thank you for participating. Please don't forget to provide your comments on the policy frameworks by Friday, April 16th.
Hello, my name is Diana Benitez, and I'm a planner with Ramey & Associates, the consultant firm working with you and the city to update the South San Francisco General Plan. I wanted to take a few minutes to talk about health, environmental justice, and equity in South San Francisco and why it matters. So let's start with healthy communities. Now, this is the framework that we're using in the general plan because we want to make sure that no matter what chapter we're looking at, that we're improving the quality of life for everyone, but particularly for those that are currently experiencing the greatest inequities and unmet needs. Now, when we think about a community's overall health, we know that it depends on a lot of different things. It depends on things like eating well, staying active, and seeing a doctor. But something that we don't usually think of is that there are other aspects of our lives that also impact our health. It could be things like our access to social and economic opportunities, the quality of the education we receive, the condition of our neighborhoods, the safety of our workplace, the cleanliness of our water and air, access to safe housing, among other things that I have outlined in front of you in these orange hexagons. And so we know that these conditions influence why some people are healthier than others and why where people live and work matter to community health. And that's why as we start writing the general plan and developing all of these policies, we are going to make sure that we're looking at using this healthy communities framework and that we're also applying a social equity lens. So I'm sure quite a few of you are asking yourselves, what is social equity and why aren't we talking about social equality? Well, let me break it down for you a bit. So when we talk about equality, we're talking about everyone receiving the same thing or the same resource, regardless of any other factors. So if you look at our blue diagram to the right, you see that people of varying heights, so having various needs, are receiving the same support, the same level of the thing. So the boxes are of the same height, and you see that they're, at the end of the day, they still have varying heights. But when we talk about equity, we're talking about ensuring that people have access to the same opportunities to thrive and succeed. So when we apply an equity lens to things, we're recognizing that people may have different starting points, so different heights. And they may need different types and levels of support, so different size boxes to be able to flourish. And we're looking at this from an equity perspective because we want to live in a world, we want to have a South San Francisco where socioeconomic and environmental factors that include things like race, income, education, or place can no longer be used to predict health, economic, or other well-being outcomes because unfortunately we live in a world where that is the case. And so one of the things that I do want to emphasize is that these factors of race, income, education, or place they're not decided by an individual alone, but by policies and laws that can negatively affect certain communities while positively helping others. And that's why we want to apply this equity lens. And I want to give you a few examples using 3 data points for the county and the city, just to put things into perspective for you. So I want to first start with life expectancy, and this is in San Mateo County, so countywide, because this is a big thing, health thing that comes to mind, how long people get to live. And the fact that there is a disparity amongst races, I think, is very helps to show that we have a problem and why we need to look at things through an equity lens. And so in San Mateo County, a Pacific Islander or African American child is likely to live 9 to 10 years less than an Asian or white child. Now that's a decade, that's a long time, and the cause can be many reasons. And we know that it's because there are certain populations, like African American and Pacific Islander populations, that experience additional stressors in life. And that can come in the form of, if you think back to the healthy communities diagram I showed you, it can come in the form of pollution in their neighborhood that can lead to asthma. It can include displacement from their home, leading to housing instability. It can include not having access to healthy food that can lead to malnutrition. And it can also include the stress of racism that can impact their ability to have access to resources and can even lead to their death, as we've been seeing recently. And I also wanted to emphasize that the state has started to think about health impacts and how to support under-resourced populations, and so that's what we're going to talk about next. Now, the state of California has been thinking about health impacts, especially for those under-resourced populations and how they can be better supported. And so in 2016, the Environmental Justice Bill was passed to reduce harmful pollutants associated health risks in disadvantaged communities, to promote equitable access to health, inducing benefits, and to promote transparency and public engagement. So any cities that are making updates to their general plan need to include this new element. So this includes South San Francisco. Now this map shows areas with high pollution burden in pink and areas with lower incomes in blue. Now you'll notice that downtown has been highlighted twice, and downtown, as you may all know, is where the majority of Latinos and low-income people live in the city. Now, I also want us to take a look at housing impacts next, and you're going to start to see a bit of. Now, this map shows housing displacement risk, and we ended up doing this analysis looking at 3 large buckets of vulnerable population, vulnerable housing stock, and neighborhood characteristics and market pressure. Now, some of the indicators within these buckets included things like households with lower median incomes, majority renter households, buildings that have expiring affordability restrictions, as well as rapid increases in rent or sales prices. Now you'll notice that that light peach has all 3 of the buckets checked, and it's downtown. It's the most at risk. Then you also notice that Sign Hill, El Camino, Sunshine Gardens, Orange Park, and Avalon have at least 1 to 2 of these buckets highlighted. Now, I'm just sharing a few of these data points to show you where in the city and what populations are facing worse outcomes that impact health. So now that you've seen a few of these data points and you're starting to see what populations and where in the city people are experiencing worse outcomes or are at risk of displacement, like I said, or have more exposure to pollution, as just a few examples, you may start to notice that, like, In the data, you're starting to see your neighbors, you're starting to see your family members, you're starting to see your friends, you may even be seeing yourself. And I just want to emphasize that these are populations that are impacted by policies and laws that have negatively affected them. And so I just wanted to give you a list of who we're keeping in mind when we're talking about social equity and health and environmental justice in terms of who we need to make sure that we're thinking of when we're developing our policies. So we're thinking of communities of color, we're thinking of children and older adults, we're thinking of low-income populations, we're thinking of people who are houseless, those who don't speak English very well, people who lack health insurance, those who live or work near fire or flooding prone areas. We're talking about renters, and we're talking about populations with chronic and acute illnesses like asthma. And now, once again, we're saying that these populations are impacted the most because they don't have the same access to resources that others do. And if, for example, they can't make rent or their house is flooded, they can become homeless or be hospitalized, and it will be much harder for them to get back up on their feet. And that's why, as I said, we are applying a health framework and we're applying a social equity lens in all of the chapters of the general plan that we're writing, because we know that some people are impacted more than others, and we need to make sure that the general plan includes everyone and helps to create healthy communities for everyone. And that's why I want to describe on the next slide a bit about how we are thinking about developing policies to address different inequities. So to address inequities, we look at 3 different processes. That includes procedural, distributional, and structural. So when we talk about procedural, we're talking about making sure that we have a transparent, fair, and inclusive process, making sure that includes increased civic engagement opportunities. When we talk about distributional, we're talking about fairly distributing resources and benefits and burdens, as well as prioritizing resources for communities that experience the greatest inequities and unmet needs. And when we talk about structural, we are talking about making a commitment to correct past harms and prevent future unintended consequences, as well as addressing underlying structural and institutional systems that are the root causes of social and racial inequities. And so that's just a brief introduction for you all to understand a little bit about what we mean when we talk about health, environmental justice, and equity in the general plan. Thank you.
And finally, we welcome you to come and join us at our series of upcoming policy meetings for the general plan update. We start on March 15th and run through March 31st. We'd love to see you there. Thank you very much and have a nice afternoon.